Hi, my name is Dr. Walter Kim, MD. I have had training in nuclear medicine as a resident and also in internal medicine. I have, however, been working in the alternative / integrative cancer field for about 18 years. And what I'd like to share with you today is what I have witnessed over my years of practice. I would like to talk specifically about inflammation and how it affects patients, particularly with cancer. I would say a majority of our patients who come to our clinic, they have advanced disease. They have either done conventional or some conventional treatments or no conventional treatments at all, or alternative treatments. But by the time they come to us for a reason. It's because they're not doing too well, they're not satisfied with their response or their condition. And I would say most patients complain or are suffering from many symptoms, which can include anything from severe uncontrolled pain or discomfort, as sometimes they call it, nausea, extreme swelling, that can include even buildup of fluid in their pleural lining or their abdominal cavity, or within the tissues such as their legs. Some people are extremely short of breath. Some people are extremely nauseated and have gastritis or issues with their bowels because they are inflamed. Whether it's due to a tumor pressing and causing a bowel obstruction, or let's say a person has pain in their pelvis because a tumor mass is pressing against their ureter and causing a blockage leading to swelling of the kidneys. The list can go on, but the bottom line is patients usually have sometimes very severe symptoms. And what I have noticed is that by doing testing and lab work, we can do several tests such as a CRP or a SED rate. What I have noticed is that a vast majority of patients have elevated inflammation levels, on average at least 5 to even 30 times above normal. And this is something that I see in almost all patients. What causes inflammation? That's a whole other story. It can be caused by many other things, but the bottom line is when inflammation is that high, it is the cause of their symptoms or their complications. And what I have found is that if you can reduce inflammation quickly, most of the times their symptoms diminish or even resolve completely. And that can be done through natural means or even some conventional means, using things like a short steroid taper or a very particular NSAID called Celebrex or acetaminophen, which is a COX-2 inhibitor known to play a major role in cancer. So what I typically like to do for patients when they come is to help them feel better. And of course we have to treat the underlying problems, such as an infection or an obstruction or fluid buildup, and of course the cancer. But what I have noticed is that if we can reduce inflammation quickly, most patients feel much better very quickly. I would say at times it's so dramatic, patients literally will say, I feel like a new person, or I've never felt better in my life. Of course, that's probably not true, but it's relative to the situation. So what I would say is, for those who are suffering from cancer, and particularly symptoms, the best way to reduce the symptoms, I think, is to reduce inflammation, at least in the immediate period. It may not be the answer or the cure. It may be short-lived because one cannot be on, let's say, steroids for a long time, but it can, what I call, calm the storm. In some ways, I look at some of these lab tests where the inflammation levels are, let's say, 30 times above what is considered normal. That's quite a bit. To me, I make an analogy of that being like an earthquake with a Richter scale of 17, or a tsunami that is so huge it could literally engulf the whole continent of Africa, or a hurricane that is just on a level that is just catastrophic. So by reducing inflammation, our goal is to calm the storm. When inflammation levels are that high, it is just absolute chaos in the body. Things are absolutely uncontrolled and chaotic. We want to bring that inflammation down and calm things down, and calm the storm, basically. So this is something that I find many other doctors may not address, or may overlook, or may not consider, but I do really think it's something that should be explored, because over my years of experience, it's something that I just see over and over and over again. And when inflammation is reduced dramatically, I would say fairly consistently, people feel much better. And cancer care is not only about just treating cancer, it's about helping patients feel better, or to relieve suffering, because suffering itself is very harmful to your health. And of course, when you suffer, your loved ones will suffer too, seeing that you suffer. The last thing I would say about inflammation is that it's been proven. There's extensive evidence that goes way back, decades, that shows, that proves that cancer actually feeds off of inflammation. And inflammation, or parts of the immune system, when activated, can actually help cancer grow. So the point I'm trying to make is there are a lot of ways we can help patients, and I believe this is one of the top ways we can help patients turn the situation around and to help them feel better, so that they can continue treatments on the road to recovery. If you would like to learn more about alternative ways to treat cancer, please visit our website and schedule a free consultation with us.